Now, what other means are available to government instead of increasing VAT, right? The last time we did it, fine, was in 2018. But what other elements could we then have increased? What could we have done? If not VAT and increasing that from 15 to 17%, as was, of course, the ire of today, what could we have done in order to bring in more income? Because clearly that needs to be done. I'm not advocating for it. I'm just asking. Clearly the question is, where do we get the money for all the needs that South Africa has at present? Share your views with us. You can do it on WhatsApp on 072-110-5584 or call us on 010-594-6010. Today's debate is again going to be on the budget. We had a very fiery one yesterday. This evening, we're joined by Economist Dr Azar Jammine. We also have Fedusa's General Secretary, that's Riefdah Ajam. So too, the South African Medical Association chairperson, Dr Mvuyisi, Mzukwa, as well as Pay the Grant Coordinator, Nathan Taylor, joining us live. To all of you, thank you so much for the time. Really appreciate it. I want to start things off here, if I may. And there are many elements that I think I want to unpack today. So we're lucky enough that National Treasury released a statement this evening saying to us that we're going to allow you to actually put out what was the leaked budget speech itself. We're allowing you to actually put that out, and it's no longer under embargo, right? So we've got the speech that was initially meant to be read out. Also, just to let you know, that the Deputy Minister of Finance is Dr. David Masondo. The other Deputy Minister of Finance is Mr. Ashor Sarupen from the Democratic Alliance. Let's not forget that they need to all be part of the consultation process. So if they weren't, why did Dr. Ashor Sarupen not necessarily make his claims earlier than he did? All right, to my guests, let's start here, why don't we? Nathan Taylor, good evening to you. How did this feel? You didn't get the chance to hear exactly what was going to be changed for yourselves. According to the leaked script we now have, we know. But did this stop the chance of you understanding the budget a little bit better? How did you feel about the postponement?
So I'm going to go ahead and assume not only yourself, Arabile, but everyone on this panel and a lot of people in the country have read the speech. So we all have to awkwardly pretend we don't know what was going to be said, because we do. Obviously, the focus is on the 2% increase. And the question is, how did that come about, rather what happened today? What really is the question is, what does this close down? Like you're saying, what does it open? Is there a chance here that has been open for us to actually question how National Treasury is pushing its own funding models? Is this a way that we get to debate our budget? Like you said, the budget is actually tabled. It's not set in stone. Or is this a way to close down that space? So it's going to be interesting.
I think it's very interesting. You're 100% right. Dr. Azar Jammine, what did you make? I mean, this was a budget that was supposed to give us some answers. Yes, you can delay it by a month. That doesn't necessarily change anything. But how important was this postponement?
I think the postponement basically gives the different political parties time to try and work together to forge a consensus response to the budget, one that all of them can live with, and present it to the Parliament in 3 weeks' time, or whatever the case may be. One got the impression that when a emergency cabinet meeting was called this morning, that something was afoot that was delaying agreement on the budget. The government obviously recognized that if it went ahead with tabling what Godongwana was going to present, that the DA and other political parties would vote against it, and therefore the budget would not be passed. That in itself is not a disaster. We've seen that in several countries overseas, not least of which a month or so ago in France, when Michel Barnier, Prime Minister, tried to get a budget through Parliament, and he failed, and he was then replaced by President Macron as Prime Minister, and the new Prime Minister, Pierre Bayrou, then made some concessions, some adjustments, and the budget was eventually passed. So it's not something that is unique to the world. It's unique to South Africa, and that is because it's the first time that a budget has been presented in a country where where there is no overall majority in one party, and that's so that party could present the budget and it would automatically go through.
But Dr. Jammine, Dr. Jammine, if I come in there and just say, I was fortunate enough to actually cover that entire situation with regards to France, having seen the election itself right through to Michel Barnier, to the new Prime Minister, of course, now in place too. But at that point, he had already put forward the budget, and then it was then being debated by Parliament, and Parliament would still need to agree to it. And I say that specifically because that is the case now too. The Finance Minister proposes a budget. He didn't even get the chance to do so. And proposing the budget then sees Parliament later on decide whether they agree to it or not. And they could have done that too. Should we not have heard the budget first?
Well, it was obviously a decision that was taken by the members of the Government of National Unity not to go that route, not to have a rejection of the budget firsthand and then to go discussing it. And they decided instead to just postpone it and give themselves a little more time to discuss it. A cynic would argue that the ANC, having been used to pushing through a budget every year for the last 30 years, tried to do the same thing on this occasion. And it was only at the last minute when last minute consultations with its GNU partners that it discovered that many of them were very unhappy. I know that I heard John Steenhuisen talking a few days ago about the fact that the DA would not support an increase in the VAT rate. He was not very aggressive and polemical about it. But then clearly, when push came to shove and he saw that this was in fact on the table, he obviously took the opportunity. And I think that that's what happened this morning. And one morning's discussion of an entire budget by 10 political parties was clearly not enough. And hopefully 3 weeks might now be a little better.
This takes me back to my question that I initially asked at the start of this, however, though. And I say this because, again, this statement that we then have from Finance Minister Enoch Godongwana was meant to read, and we're lucky enough that we are able to then put this on screen because the embargo has been lifted on what would have been the Finance Minister's speech for today. It says this, in the conclusion of the speech, by the way. It says, in conclusion, Madam Speaker, it is important to reiterate that through the policy choices we have made and the carefully targeted allocations, 3 words, we are proposing. It's not final. Nothing is final here. Public institutions and entities should be in a better position to continue delivering services. Why do I highlight that? Not because it doesn't matter to have the kind of conversation that matters, but this is a proposal that Parliament in the past has always been able to refute and say no to. And yes, they've been able to get it through because the ANC has had the majority. Now they can't do that. But you even had Ashor Sarupen, who is Deputy Finance Minister, in consultation here. And today, the DA is the first ones to say no to this budget. Yet it was just a proposal. They could have said no earlier than today. Now we've wasted costs. All the costs that we say we shouldn't have, all these people that flew to Cape Town, isn't that what we should be worried about as well? Let's ask you, Riefdah Ajam, what do you think? What did you think of this proposal and this postponement, as it were, right now? How much more needs to be done? Are you happy?
Well, we have to take a look at it in the context of the complexities that actually reflect and are inherent in a coalition government, while at the same time highlighting the importance, though, of thorough deliberation of fiscal policies that impacts on all South Africans. And as you rightfully say, time was wasted, money was wasted, money that could have been allocated to infrastructure investment, money that could have been allocated to investments in key public sector concerns, to be able to drive this developmental state that we are looking towards. And what our take as Fedusa is on this particular matter is that whilst it is not an ideal situation, we have to somehow commend the government for their commitment, number one, to transparency, and number two, towards inclusive dialogue, which is evidenced by the decision now to delay the budget presentation with the intent of achieving consensus amongst the coalition partners. Whilst we see this as a bit of a bittersweet moment, we want to believe that in many instances, some of the complexities are also being heard.
Dr. Jammine, just wanted to ask if you could head on to silence, please, if you could just put yourself on mute there. Apologies there, Riefdah, as well, just to continue your comments. Apologies. Please put yourselves on mute if we aren't actually at a point of speaking as yet. Apologies, Riefdah. Please continue.
No problem at all. So whilst this is not an ideal situation, we certainly believe that there's greater space for maneuvering, greater space for consultation, but even greater space for transparency as we move along. It's not ideal, but what we want to see decisively come the 12th of March is the fact that where these most unfortunate aspects have come about in terms of a 2% VAT hike, what exactly is the detail there? Because as Fedusa, we have constantly been calling for the disproportionate removal of pressure on the working class and ultimately to give that leverage in such a way that we shift the burden and that we allow for greater space there for introspection and giving us the space then to be able to dive deep into the areas in terms of policy where we are then able to collaborate and co-create solutions. At the end of the day, it's not helping anybody where information was available beforehand and we had, whether it was deliberate or otherwise, sat on that detail and we are where we are today.
Okay. Mvuyisi Mzukwa, Dr. Mvuyisi Mzukwa, thank you so much for your time. What are your thoughts?
No, thank you so much for the opportunity. I think we, as the South African Medical Association already, we had issued an urgent appeal to the Minister of Finance, Mr. Enoch Godongwana, urging him to allocate significantly increased funding to the healthcare system. But unfortunately, as you know, the speech was postponed. But there's a buzzword that is being used currently by the media to say this is unprecedented. For us in the healthcare sector, we have been experiencing these unprecedented events, strain on the healthcare system. We have never seen times like this when there are so many healthcare workers that are unemployed, especially doctors. We have never seen such a level of dilapidating buildings, the stock outs in the hospitals. We've never seen mismanagement of healthcare system as we see in the provinces, and also patients, cancer patients being turned away because there are stockouts of chemotherapy and many other things that have happened. I mean, in some hospitals recently, there's been water shortages for more than 2 weeks. And we thought, really, this is unprecedented because in those cases, then you suffer in terms of service delivery. I know, again, that many people, when it suits them, they are quick to quote the World Health Organization in terms of where we should be going. But they do not quote the World Health Organization that it says for each country there should at least be one doctor for every 1,000 citizens. Yeah. They do not tell the nation that the World Health Organization has said that there must be a 5% expenditure on healthcare versus the GDP of the country. And as in South Africa, we've been spending 4.1. The 8.5 that we're talking about, we're adding the private sector, which is sitting at 4.4. So it means government has been for a long time underspending in terms of allocation to healthcare. But also there's been a challenge where you find that for decades we've been experiencing these budget cuts, but also austerity measures that was experienced as healthcare workers.
Yeah. I mean, the plight of healthcare workers has been made clear for the longest time now, and that's been a major debate as well. And I think it has to be highlighted. But we never got to see the details. And Riefdah, earlier on you spoke about the details of that 2 percentage point increase in VAT. We never got that, right? But I'll give that to you in just a moment. But before we do that, let's just go to our callers here. Richard and Harry Smith. Just your comments, your thoughts, please.
Thank you very much. My suggestion is that this was done during the past regime. I think that was good in order to increase the coffers of the state. What must be done? There must be a petrol levy. If you put petrol after 6 in the evening until 6 the next day in the morning, they must put that levy. Maybe during the past regime, you were paying 5 rand. Even though I can't remember the years, but that was done. But this time it must be 10 rand. 10 rand if you put petrol or diesel in the evening at 6 o'clock until 6 o'clock in the morning.
Oh, I wonder how.
That might not be increased.
Yeah. No, I hear you, Richard. Thank you for that suggestion. Perhaps a thought for the minister here and something that we could ultimately change, could see being different. Natin Centurion, your thoughts?
Yes, good evening. How are you, sir?
Fantastic. Thank you so much. What is your suggestion? What is your comment?
No, my comment on the increase of VAT is, I ask myself that it's our leaders or our government know how to create employment or how to improve the economy of the country, or they know how to create unemployment. Firstly, we do have our natural resources, but our natural resources are not protected by our government. We must stop this thing of we must not allow raw materials to get out of the country. They must be processed locally, so that those raw materials, they can create jobs. They can create a revenue to the state. Like, for instance, we do have like in some mining towns like Rustenburg and Begersfort, the Chinese, they are getting chrome with a very cheap price from locals. The reason why, those locals, they don't have capacity to process that chrome or the skill to process that chrome. Those are the important things that our government must focus on, so that they can empower those people. Those people will create employment, and when there's a revenue, then that revenue, it will benefit the government as well. This thing is of increasing VAT is going to affect poor people, it's going to affect businesses, and again, people, they will end up opting to sell goods and services on cash than electronic payment system.
Sure.
Because they're trying to find a way how can we save money by not paying this 70%. I think they must consider that our asset is our natural resources. That's where we can focus on in creating jobs and to create revenue for the government.
Nati, the most important thing for me that you said in all of that is empowerment of people. Because if we got that right, ultimately it would mean that we wouldn't rely so much on the state ultimately for all these aspects as well, because the state itself would have actually empowered us. There's still so many aspects of this budget that we haven't been able to go through. We haven't been able to unpack vigorously as well. And if you wanted to know where the detail is, it's in this document. It's actually in this document that we never got to hear. And I'll tell you what a little bit of that detail is, where perhaps And I'm just suggesting, perhaps we should have heard it. And then Parliament refuted after. But instead, it was the big stage, it was the grand stage in which it makes more sense to grandstand, to ultimately show that we're fighting for you. Yet, we don't know what it is that you're fighting against. Maybe. I don't know. Just a thought. We'll continue with our panel after this. Thank you so much for joining us and welcome back then to Newsfeed PM, the late edition. What other means are available to government? Instead of increasing VAT, let us know. What do you think they should have done instead? I mean, that was the contentious part, right? So you can, of course, talk to us then on WhatsApp, 072 110 5584. That's 072 110 5584. You can also call us 010 upon this number then as well. Just actually need to check on that number as well if I don't mind. I just want to get the auto key to go down a little. 010 594 6010. That's the number there for you. Joining us, as I said a little bit earlier, Dr Azar Jammine, Fedusa's General Secretary, Riefdah Ajam, South African Medical Association Chairperson, Dr Mvuyisi Mzukwa, and Pay the Grant Coordinator, Nathan Taylor, joining us this evening. So, what was the detail that perhaps we didn't get when it comes to the speech today? Well, let me give you a little bit of that. The Finance Minister said, we thoroughly examined alternatives to raising the VAT rate and the policy trade-offs that were involved. So he looked at other things that he could do. This wasn't the only thing he looked at. In fact, he thought about increasing corporate as well as personal income taxes. The other two big ticket items in our VAT, in our tax bracket, well, he thought about those as well. And he says these would generate substantially less revenue. In fact, because they're going to increase VAT, as they had initially were going to propose to everybody, including Parliament, they said, well, we need to try and protect vulnerable households. In fact, they say, this is what the minister was going to say. This is why we are taking concrete steps to protect vulnerable households. And the steps include 4 measures. 1, they were going to increase the basket for zero-rated goods. Now, there are certain goods that you don't necessarily pay VAT on. These include bread, milk, eggs, fruits, vegetables, maize meal, etc. And they were going to raise the basket on that. That's 1. 2, they were going to extend the fuel levy relief for another year, right? So it would have saved around 4 billion rand itself. They would have provided social grant increases above inflation. So it wouldn't have just been an inflation-linked increase then for social grants. And then they would have also adjusted personal income tax brackets. That's the detail we also didn't hear. I'm not saying it was enough. I'm not saying it was right, it was the right measures. I'm saying we didn't get to hear it. And because we didn't get to hear it, we can't actually debate this thing the way we probably should. Dr. Azar Jammine, what did you make of that detail that we missed?
Quite clearly, what the minister tried to do was, in the midst of raising the VAT rate by 2%, as you say, he gave many other significant concessions, such as VAT exclusions on the like of meat and poultry. That's huge. And would have cost billions. Yeah. Also foregoing a fuel levy increase. Now, many years ago, when VAT was first introduced, I think it was called the Katz Commission at the time, concluded that the most effective way of introducing VAT was with as few exclusions as possible. But what the government has now gone out of its way to do is to try and help the poor. And it's also, we're just talking about what alternative tax measures could be taken. What we haven't spoken about is what alternative expenditure schemes could have been adopted. And here what we've seen is this budget was to be used to expand the social grant network substantially by increasing social grants at a rate well in excess of inflation, which is a new phenomenon. In previous years, most social grants were increased in line with inflation. Here, he was going to increase them by a lot more than inflation and spend an extra 23 billion rand over the next 3 years on that. And that's why, I suppose he felt he needed extra taxes. So the alternatives are really to do away with all this relief of social grants and simply to leave the VAT rate where it is. and leave the status quo as it is. But that is the alternative. And this is what is obviously going to be debated over and above possibly looking at more innovative schemes. At the end of the day, you can't get away from it. If you don't grow the economy fast enough, you're not going to collect enough taxes to be able to accommodate social grants and education and healthcare.
Nathan, your thoughts as pay the grants coordinator here? If that were the case, if this really is the truth, then that they were going to raise VAT so that they could pay more grants, is it not just working against each other? Because you would have raised VAT and then unfortunately meaning that it's costing too much money for people to buy goods and services, even though their grants have been increased.
So, Arabile, I think you can probably ask the question, does it make any sense to take from the poor so you can give to the poor?
Yeah.
And obviously, I do disagree politely with Dr. Jammine. We can say that some social grants have increased at some of the years in the past, certainly not at inflation or to account for actually the cost of living that people face. We do know from the now not embargoed documents that no, the SID is not increased. Actually, the great difference, a very interesting difference since 2020 when it was introduced, this is the first year that actually they haven't cut the budget for once. Yeah. So I guess we can call that an increase if we just ignore the cost of money and inflation. The fact is, I do agree that there does need to be an idea of how do you tackle productive spending. But I think from Pay the Grants, we have a very clear position that if you really want to figure out how to create a growing economy, and that's where we are worried about what the DA thinks that means. How you create a growing economy is you grow its people. And we don't see that in terms of giving cuts to corporates or, I guess, like even the talk, the President of London, Napi, by looking at your production chain to developmental state, how the mining sector goes, or even the fact that you let companies like this get away with such environmental damage and avoiding the actual tax violations around it. You actually give to people who live in this country. Yeah. And the social protection is a way to transfer money. It's a way to transfer a way of life, a ability to live, survive, and grow livelihood.
Yeah.
So that's why we do very much call for the idea of the SID. We do very much call for more than just the SID. We look at the idea of the basic income. If you want to see a productive society, give people the ability to engage in it.
So Nathan, where do we get the money?
Sure, it's a great question. So it's very funny that I guess like we're looking at the 2% VAT increase, and we are looking against the corporate tax and the personal income tax, and the idea of Godongwana saying that it's not as effective or it won't raise as much. You got to again question: do you measure the effectiveness of that and how much revenue it raises if you ignore the damage it causes? And I think from us, we very much view the obvious answer as a longer-term idea of the wealth tax. And this is something that SARS is even building into its systems at the moment. And there is a very good reason beyond that the tax boss the SARS Commission was fighting with this proposal. Even without even talking about the idea of wealth tax, they're pointing out that even capacitating SARS could lead to much higher revenue collection in taxes, which we've seen repetitively over the last few years.
Yeah.
There are different sources where you can pick them apart. I won't pretend to break down a 20-point, 200-page document here, but they do exist, and they should be debated transparently.
Yeah. All right. Riefdah, what do you think? Where do we get the money? Oh, I think you're on mute, Riefdah. Apologies for that.
My apologies. There have been a couple of ideas that Fedusa has been throwing around over the years, and we continue to amplify our voices on this particular matter. Let me just state this categorically, that we are in no way in favor of any form of austerity measures. We are a developmental state, and as such, we have to drive this process forward. As Dr. Mzukwa said, listen, not an unprecedented situation when you take a look at the health workers or the health system, just from one lens in particular. But I'd like to look at it from a holistic lens in the public service. Let's not fool ourselves at this stage. And I'm going to come to your question. I wanted to amplify the following. In 1994, at the advent of democracy, we had 1 million public servants. Today, we have 1.2 million public servants and 70,000 unfilled posts, critical posts that can deliver on the National Development Plan and the targets that have been set for 2030. So we need to understand we've got to ensure that we do not forget the plight of the poor and the plight of the working class. So if they are unable to access services, how then do we erode their contributions overall? But let me come to the actual question. I wanted to contextualize that in light of the assertion that Dr. Mzukwa had made. We don't even speak about education, safety and security, correctional services, home affairs, and other matters. But to dive deep into the alternates, what are we calling for from a Fedusa perspective? We look at one particular element, and that is to expand the revenue collection. And this is within the SARS unit. You look at illicit financial outflows. We have consistently called for an arrest of that process. Outflows in all its forms need to be addressed. And at the same time, we need to expand the capacity of the customs unit within the South African Revenue Services. Currently, we only have 2% of all goods and containers entering the South African ports that are currently being subjected to inspections. We are losing dire revenue. So ultimately, we have to recruit more members. And we are speaking about that on the basis of meritocracy. We simply cannot continue with this austerity agenda. That's the first element I wanted to raise. On the second point, when we look at what is happening right now, Fedusa speaks about an issue called tax justice, and we have to look at it in the context of alleviating that disproportionate struggles that the working class are currently being subjected to. And one of those elements is to ensure that we are able to, in this way, institute and implement a wealth tax with the explicit focus on taxing the super rich.
Yeah.
We've got to do justice at the end of the day, because ultimately avoidance of tax and all that tax base that we are losing out on could have been extended to dire public services where they are needed. We have given this much introspection in terms of the overall complexities, and we specifically zoom in on the super rich for a particular element where we are able to put stricter regulations in place with the intent of compliance and monitoring. So those are two elements that we haven't heard coming through effectively that will ultimately contribute towards expanding that base. That is two specific ones that we want to address in the face of what is happening right now.
Yeah, it would be interesting to find out if we're actually going to get that kind of conversation actually happening as well. Let's quickly just go to a call here. Carrie in Johannesburg, your thoughts and comments, please.
Good evening to you. If the government officials no longer were treated with bottled water at their desks and fancy meals left, right and centre for every occasion, I'm sure that would contribute hugely to those less fortunate than they are. And then the salaries, they get these massive increases. Someone hasn't had an increase for 2 years. Shame. But they can drive and be flown all over the world at the expense of everyone else. Rather, put that money into the people of the country that are struggling, and many of them going to bed without any food.
Carrie, appreciate your thoughts this evening. Bottled water and the fancy meals that our ministers and government officials alternatively get at a lot of their briefings, their coordinations, their meetings, even some of their salaries is what Carrie says should then be reduced. Sabelo in Bloemfontein, your thoughts? Good evening.
Good evening. My thought is very simple. One, we need to tax more on the people now who are going to be regulated, the foreign spaza shops, because those people have been robbing the government for quite some time. So in terms of also of competitiveness with the government, with local businesses, we need to make sure that those people are not taxed a regular business tax, but they are given a high percentage of taxation, because there's no skill that they are bringing. The foreign spaza shop, they are not bringing any skill or any special investment, because also they are not creating jobs in the local community, so they must be taxed more. Yeah, so I think that's the main thing, because when we charge into the big capitals in South Africa, you start having a problem. So let's start here at the lower phase of taxing the foreign businesses much higher than the local.
Perhaps that's one way to do it. Foreign-owned spaza shops, perhaps being taxed or having penalties put on them, as opposed to having local-owned spaza shops and businesses ultimately taxed a similar amount. Let me quickly go to Mvuyisi, Mzukwa. Just before we go to an ad break, just a couple of seconds from you. What your thoughts overall here? Yes, of course, as the medical association then, but overall as well, are we building a state in which we can collect enough to be able to help even people like those that are part of the medical association?
Yes, Arabil, I think we are focusing only on injecting cash, to all the sectors of the system. What we have seen in the healthcare sector is that there's been a lot of corruption, but also lots of misallocation of funds. But let's talk about corruption, what it did. They're investigating about 3.4 billion, that has been lost to corruption. And if you look at further statistics, there's so much money that is being lost from a healthcare system, due to corruption. So even though we are calling for this injection of cash, but we are saying there must be financial transparency and better management of the resources, so that they reach out, to the needy communities, and we can build up all these dilapidated infrastructure and move forward with the country.
Yeah, very important one, understandably so. We'll conclude the conversation just after the short break, because, yeah, we don't have the budget as yet, but we'll have it on the 12th of March, hopefully, as well. So we'll conclude this conversation right after this. Stay tuned. Welcome back. We're still talking about the budget speech that didn't happen then, of course, today. The postponement of that budget speech to the 12th of March then, missing out on key aspects as well. But the key reason was that 2 percentage point increase that was touted as being proposed then by National Treasury. What other means are available to government then instead of increasing VAT? What should they have done? Your views on WhatsApp 072-110-5584, calling us on 010-594-6010. Then we are joined by Economist Dr Azar Jammine, Fedusa's General Secretary, then Riefdah Ajam, South African Medical Association Chairperson Dr Mvuyisi Mzukwa, and well as Payers, the Grant Coordinator Nathan Taylor. Let's quickly just go to some of the WhatsApp messages then that you have sent through as well this evening. From Thabo Mokubedi, saying that the Department of Health does their budget, so National Treasury will not give what is not needed. The CFO, as well as the Director General of Health, must be blamed, not National Treasury. More money in health goes to litigation, so the Department of Health must work. That's from Thabo Mokubedi. Now, Hosea, I think in the Northwest, they're saying, hi, Arabile, my question is, if the agreement has not been reached on the 2% increase in VAT, 2 percentage point increase in VAT by the 12th of March, what happens then? That's a very good question. I'd also like to know, does that mean we keep postponing? Does that mean we don't have a budget then moving into the remainder of this year? Does this go into the next financial year for government? What happens then? Very valid questions. We can't unfortunately get them, however, from the Finance Minister, because he can't speak until the budget is actually laid down now. So this is going to be very interesting to put out. Now, the basic income grant should be paid to companies as a tax rebate for employing workers or employees for a few years. Call it a basic employment grant. Mel Nicholson there with an interesting proposal to be put forward, perhaps one we should actually be touting. I don't know what you guys think. That very last one perhaps offers some key thoughts. Let me perhaps come to you, Riefdah, with regards to that one. I don't know what your thoughts are. That basic grant then, which would come through for those who hire a certain set of people then for a particular number of years. What are your thoughts?
Well, it's an interesting proposal that has been tabled, but what we need to unpack is the fact that we have to unlock the potential of existing policies that we have right now.
Yeah.
We've always been asking the business community to take hands with us and deal with the situation in a complex way that brings about lasting solutions. What we do have right now is something called the Employment Tax Initiative, the ETI, where there is a discretionary rebate allocated to businesses in particular that hire young workers. This is a means to an end, and the actual consolidates are able to be extracted from payroll, where the employers that are using the incentives as a result of the scheme are able to then quantify the value of how the contributions have been and what the uptakes are ultimately. It's unfortunate that it has been extended on the one round, and we have not seen the kind of uptake that we so desire. We don't necessarily know why, but ultimately, should there be a mismatch, let's look at the critical skills list that is available currently so that we can deal with the matter. There are a number of other schemes that are in place right now.
Sure.
So I just wanted to zoom in on that factor. We've got infrastructure in place and policies that sets the tone, albeit the youth employment schemes that is housed within the presidency. So why are we not getting the desired results from those kind of policies and schemes that have been put in place? So ultimately, it's about implementation, and more especially so, the political will on both sides to be able to drive it. We've got the landscape.
Yeah, we certainly
why
do.
Are we hesitant?
We certainly do. Dr. Mvuyisi, Mzukwa, let's get your final thoughts.
Well, we believe that as the South African Medical Association, investing in healthcare is not simply a financial decision. It is a moral and an economic imperative. And we do think that, we should not allow any further decline of a healthcare system. We are in a crisis already.
Yeah.
We want to be out of the crisis.
We certainly do. Nathan Taylor, your final thoughts as well here.
And I'd love to use them to lend a voice to Dr. Mzukwa to talk about that one person who said something about National Treasury not to be blamed for what's happening in health. But I'll leave that for another day. If we want an economy that works, we need to actually invest in the people. And I absolutely agree with Fedusa. We have a bunch of public spending programs that try and look at employment in short-term basis and temporary. And very much, it's very much the over-determination of the democracy. I mean, not the democracy, the bureaucracy, the conditionalities, the issues to actually even get through. That not only you can talk about companies, but actually people themselves signing up for these programs, they get so little out of it at the end of the day. If you ask even somebody who's gone through the public works programs, what has actually benefited them in the long term? It's this idea that you do not trust poor people to actually make something of their lives. So you give them very regimented, tiny little chances that lead to nothing. We believe that you actually need to take a dedicated and consistent investment in people. And so, no, I don't think basic income, pay the grants does not think basic income should be paid to companies. We've seen that happen before. We think actually people are what make it.
Okay. Dr. Azar Jammine, your final thoughts, please. Hopefully you can also help us answer what happens if we don't have an agreement by the 12th of March.
I do believe that we will have an agreement of sorts, and it may not be a 2% VAT hike, but something somewhat different. One of the easy ways out, of course, is to increase the budget deficit and, as a consequence, the public debt. The result will be a weaker currency and higher inflation and interest rates, obviously. But really, what is needed and doesn't come through forcefully enough is the will to actually create an environment in which employment is spurred to a far greater extent. And Mr. Taylor mentioned human capital, absolutely critical, education, spatial development. There were allusions to that in the budget review, which is very encouraging, but no mention of development of small business activity.
Yeah.
And nowhere is there a willingness to try and help small business get on the road.
Look, so many elements. We also didn't get to hear some of those elements, but 12th of March is when we're hopefully going to be hearing them as well. To all of you, thank you so much for joining me this evening. A really interesting discussion, one that is bound to continue now because we still have a budget to ultimately listen to as well. So to all my guests this evening, thank you so much for joining us again.